This is a review of landmark papers for damage control laparotomy from the East Landmark Papers in Trauma and Acute Care Surgery online resource. This paper focuses on the importance of early enteral nutrition in the open abdomen to improve fascial closure, complication rate, and mortality. At the time of article publication, enteral nutrition had proven beneficial for patients with critical injury, but the application in patients with an open abdomen had not been well defined. Therefore, 597 patients with an open abdomen after trauma were retrospectively reviewed at 11 trauma centers from the Western Trauma Association during 2002 to 2009, specifically to examine fascial closure and nosocomial infection rates. Of the patients, 92% had an open abdomen after damage control laparotomy for trauma, where the remaining 8% had surgery for abdominal compartment syndrome. 39% of patients received enteral nutrition before abdominal closure, beginning at an average of 3.6 days after injury. Fascial closure rates were higher in the enteral nutrition group, 75% versus 67%, but the time to closure was significantly longer in the nutrition group compared to the NPO group, 9 versus 5 days. 307 patients without a bowel injury, logistic regression analysis indicated that enteral nutrition was associated with higher fascial closure rates, decrease in complication rates, and decreased mortality. For the 290 patients with a bowel injury, regression analysis showed no significant difference between enteral nutrition and outcomes. In conclusion, enteral nutrition in the open abdomen is feasible, even in those with bowel injury. For those without a bowel injury, it is associated with marked increase in successful fascial closure.